Hi, I'm Rebecca Marshall here with Dr. Richard Rosenfield of Pearl Women's Center, a board-certified gynecologist and surgeon, and we're talking about chronic pelvic pain today. How you doing?
I'm doing great. How are you?
Great. Let's talk a little bit about chronic pelvic pain. How do you define it?
Well, we define pain as either acute or chronic. Acute pain is something that most people are familiar with, for example, after a sports injury, something that there's a trauma to the body, and because there's a cause and an effect, there's immediate pain. Chronic pain, which can result from acute pain, we typically describe as something that's lasting months. So the textbook definition is 6 months of pain, but I think for a lot of women it's really the definition of having pain every day or pain that's disrupting one's life.
And so how would you go about treating chronic pain? I mean, how do you break it down to determine exactly where it's coming from?
That's a great question, and really I think for most problems in healthcare, as a physician, the most important thing we can do is get a very accurate history from our patients and try to figure out exactly what perhaps the causes might be. And I tell my patients when they come into the office, especially for something complicated like pelvic pain, keeping in mind that this is one of the most common complaints that women seek care from a gynecologist for. But when they come in, I explain that, my job the first day is sort of to play detective and try to sort through various factors in that woman's history that may have led to this pain. And once we start sifting through the medical history, surgical history, and a menstrual history, we start trying to piece together perhaps what the cause of that pain might be and where the pain might be coming from. And after we do that, then we start creating a path for the diagnosis and treatment of the pain, and that might be imaging, it might be just doing an exam, and trying to really assess what's going on with our patients.
When we talk about pain, what kind of pain? Is it sharp pain? Is it aching pain? What is it?
Well, I think that probably the first thing to do is talk about pain pathways and how does pain happen. So when we describe pain, we describe two types of pain in the body. One is somatic pain and the other one is visceral pain. Somatic pain is the pain that we notice if you were to get a scrape on your face or on your hand, you know exactly where that pain is coming from. The nerves that innervate the skin and the superficial parts of your body, it's very obvious that the brain knows exactly where that insult is happening. But visceral pain is different. Visceral pain comes from nerves that go to the internal organs, and that also includes a woman's pelvis. So oftentimes, while a woman may think they're having pain that's coming from their right ovary, it might be from the colon, or perhaps it's from the pelvic sidewall. Maybe it's from walking to school and having a backpack on the right shoulder that's causing the skeleton to be a little bit shifted to one side or another. And that's because visceral pain can be a little bit more difficult for us to understand. And the pain pathways are very interesting as well. Without having a functional brain, you don't have the sensation of pain. And pain occurs in the brain, but there's an insult happening at the end of a nerve, and then the signal of pain goes through the spinal cord. The spinal cord is it's like a gateway, a freeway, where signals go from the organs to the brain. The brain processes this information and tells our patient, hey, you're having discomfort, and this is uncomfortable, and this is going to really have an impact on your daily life and in your daily work, and can lead to things like depression and time off work and perhaps even surgery.
So having said that, you really have to narrow down where this is coming from. From then, how do you treat it? How do you go about treating it?
Well, the treatment is largely based on the stuff we just talked about. So once we figure out or make a guess as to what's happening, we sit down and we talk to our patients and say, listen, within the world of treatment, we have medical options and we have surgical options. And for many patients, they've been dealing with problems for a very long time. They want to move right towards surgery. And surgery in my world is typically what we call laparoscopic or minimally invasive surgery. And what that is really taking a look inside the body to find out what's going on. For many patients, that's a scary thing. Going to have surgery, being under anesthesia is something that's very frightening, although at the time of surgery, we might be able to cure the problem. So we also offer maybe medical management, where we try to alter things in our patients' lives that might improve their pelvic discomfort. And sometimes even in the office, we notice that perhaps there's something like a trigger point. I don't know if you heard of a trigger point before?
Yes.
And trigger points are these interesting points in those somatic nerves where there could be a little bit of a nerve entrapment. And sometimes injecting these trigger points in the abdominal wall or even in the pelvis can give immediate relief for the pain. And that's because the nerves that go to the skin enter the spinal cord at the same place as the nerves that go from the organs. So sometimes doing these trigger point injections or trying to isolate areas on the outer part of the body can relieve things that are deeper inside.
You know, you mentioned the fear of surgery. I mean, surgery is a scary word, and people don't realize the technology today and just how amazing it is. Are you yourself amazed at the technology and how minimally invasive it is?
It is. It's pretty amazing. Even, you know, this podcast right now, the technology that we're using with high definition video and being able to really engage with one another and see things better in the audio video world, it's the same in the operating room. We're using better equipment than we've ever been able to use before, and as a result of that, we can do surgery that is equal to or better than surgery of years before, but we do it in an outpatient setting, and we can take a look through little tiny incisions in a patient's skin and really have a good impact without taking, you know, time out of their lives or making big incisions. But it is scary, and we want to make sure that if we're going to go to the operating room, that both the patient and the surgeon agree that it's the proper time.
Yeah, and so do you find, since there are so many ways that you can have pelvic pain, is there a common denominator or even just a common patient that comes in?
Well, there are. We really feel that it's very important at the Pearl Women's Center to individualize patient care, because there is a tremendous variety despite the commonality. And so some of the common things that we do see with patients that have pelvic pain, maybe upwards of 90% report that they have pain with intercourse, which you can imagine how debilitating that can be for your, you know, for your home life. Missing work, symptoms of depression, myofascial pain or fibromyalgia. There's a lot of different things that go hand in hand with chronic pelvic pain. And there's another big word, endometriosis, which we see thrown around a lot in our world, which we don't understand why it happens. This is a disease that we've known about for years and years and years, yet there's an empty Nobel Prize, you know, waiting for the person to discover what exactly is the cause of this problem. We know that endometriosis is a condition where the lining that should be coming out during a woman's menstrual cycle, that cell type is in different areas in the body. So endometriosis is defined as seeing these endometrial implants in different areas inside the pelvis, and it can cause a significant amount of pain because these cells react to hormone shifts. So you can imagine as your menstrual cycle changes, if you have these little implants in your pelvis that are expanding and contracting and they're next to nerve tissue, it can cause a lot of pain.
Yeah, I've had friends that have experienced that, and it's just like, you're right, it's debilitating.
And it's not just the debilitating part. When a patient has chronic pain and every day this is on their agenda, sometimes they forget what it was like to be normal. And then they also talk to friends or family, and they say, you know, this is just part of being a woman, you know, deal with it.
Yeah.
And that's just not appropriate, because the reality is nobody understands your personal experience besides you. And so if you're having significant discomfort, it's important to be able to seek help and know when it's appropriate to seek help.
Now, is that something that you can see with some kind of technology, see the problem? Because you don't know what people's level of threshold of pain might be when they do come in, though.
And oftentimes we can see what the cause is, but sometimes we can't. For example, getting back to, you know, endometriosis is only one of many things, but it's an interesting thing to talk about because as visible as it is during surgery, it's not typically visible with any imaging studies. So it's a difficult thing to diagnose, and sometimes the surgical option may be the best one, even as a diagnostic tool. But there's other things that can be happening. There could be, for example, diverticular disease or an appendicitis. Well, there could be an ovarian cyst, and we have a lot of patients, especially in this region, that are overweight. With obesity, we see things like polycystic ovarian syndrome, which is another long term. But essentially that one, and we're going to get into this discussion later, can lead to irregular menstrual bleeding and irregular feedback from the ovaries to the brain. The bottom line is chronic pelvic pain is very difficult to diagnose and to treat, and it's really, really important to make sure you seek expert care, because it can be very overwhelming for both the doctor and the patient to try to figure out what's going on.
And looking forward to the future, are there certain parts of technology or in your industry that you're looking forward to?
Yeah, you know, there's always a constant evolution, both in the surgery world, but also in the world of imaging, and even in the world of looking at immunology and blood work. And there is a lot of research in the world of endometriosis because it does affect about 10% of our female patient load. So it's a pretty big disease. But we're always looking forward to the next thing. We hope that the progress is good progress. Sometimes we feel that things take a little bit of a step back, but for the most part, the stuff that we're seeing is actually really, really promising.
Oh, so much to talk about. Thank you for your time today.
Thank you.
Dr. Richard Rosenfield from Pearl Women's Center talking about chronic pelvic pain today.